Oh, look at you. Look at your ears. But he's trying to run us down in the pasture right now.
These ribs are displaced as well.
Yeah. So we're gonna try Miss Nadia.
This is Nate, and this is Cindy. This is their shelter. We are a full circle of life horse shelter, and we never turn an animal in need away. Every one of them has a story and has paid a price. One thing we've learned in 11 years, you just never know what's gonna come through the door. Welcome to the Horse Rescue Tales from the Tundra.
Hello, Mama Rose.
I thought she had eyesight problems. The vet said no.
How are you doing?
Hi, sweet girl. I took that. Yeah. You're a good girl, aren't you? You're a beautiful girl. Hi, sweetheart. She only whinnied once since her buddy left. She only whinnied once.
You can come with us, and there's lots of friends there.
See her back end, how it doesn't. She has a smooth trot. She has a smooth trot, but she doesn't have a.
Okay. Yeah, we'll definitely look into that.
Come on. Berry food. Come on.
Very nice, babe. There you go. We're tricking you a little.
Good girl. Good girl. Come on. One more step.
Good girl. A little bit further now.
Good girl. One more step. One more. Come on, honey. Hi, sweetheart. Good man.
A little bit more.
Come on. Come on. One more. Come on. Come on, here.
Good girl, honey.
Good girl. Hi, honey.
All right, honey, we're back. So this is Mama Rose. Her caretaker got her from a hoarding situation. Just had her for a little while. She thinks she's got some EPM going on. So we'll have her looked at by our vet.
Welcome.
And we'll see. Here you go, friend. Put her in 4. Good job, babe.
1, 2, 3.
I said, of course, to the horse.
Judah! Perfect. Hey, Miss Judah here is going home. Come on, Judah. Good lady.
Oh, look at you. Look at your ears. Oh my gosh.
None of ours compared to.
They're huge. Hi, Denny. There you go, babe. Let's go make some friends. You know, pigs were in that. You don't like that. Good job, honey. Look at you, so cute. All right, Denny. We'll get you inside. Good job, Denny.
Bigger than the horse next to you.
Yeah.
She's been with the gold.
Okay. Oh, that works. Mama Rose is like, you look like me but look different. But she was by herself too, so she's like, what the heck are you? Okay, so we are down here. I'm trying to get intake pictures of these guys. Guy's hurt and I get that, but he's trying to run us down in the pasture right now. I've had to run away from him a couple times. I'm not even near him. He just kind of gets pissed off. So we have a stick. I'm gonna try and get more pictures for me. I'm gonna try and just shoo him as soon as I go in here. Pull it out though towards us, just in case I need to come back out. Hey, you. Go over there. Yep. Yep. I need to take pictures. Okay, I have to get a little closer. This is about... No! No! Okay. Well, I think I got at least side pictures, so maybe we'll come back out when there's more people.
So we should
Watch
go
it.
to them first.
Yeah, we'll go over to them first. But I have maintained this distance and he still gets upset, so.
There's a lot of scary tide.
Watch it.
Do we need this one? 382?
Nope. Oh, yes. Whoever 449 was. I don't know where. Oh, that one's up at the...
382 though. Do you need him?
Yeah. Get back.
Oh, I don't like him.
It's nerve-wracking.
Let's get him quick.
Yeah, okay. Okay, we closed the gate over there. He walked in there, so hopefully he won't bother us. We just have to get one of the ones that's in there, but we can worry about that after.
Yeah.
All right, we got all the pictures. We let them back out. Boy,
So cute.
he is. So we have Dr. Kenzie and Dr. Val coming out today. Yes, Dr. Val is back. We're super excited. It's going to be kind of crazy. Kenzie's got dental to do. We got to get all the quarantine horses looked at, a couple new surrenders. So fingers crossed it just all goes well. So this is Mama Rose. Picked her up yesterday. The lady said she's, when she had gotten her, she had an active case of EPM, and she was treating her for it. But she thinks that there's still something going on as far as that goes because she's still just wonky in the back. Hey, Jenny, I have to talk. Pause. I'll let her get it out.
Let her say her piece first.
Okay. She did say that this wound back here had been open for like, I want to say she said 5 years.
Okay.
It looks better now, and then there is some like scarring in the back here. So she didn't know if maybe any of that had anything to do with the offness in the hind.
Wonkiness, okay.
So yeah, that's kind of Mama Rose.
Mama Rose. Hi, honey. Keep your head this way.
And she is papered. She didn't give us the papers, but I do have her exact birth date.
Oh, perfect.
But we don't need a Coggins or anything, so.
Okay. Hi, sweetie.
And she is head shy, she said.
Okay.
A little nervous as far as that
Steven's
goes.
a little worried, huh?
Oh, it's been almost a year. It's going to be so exciting to see her. Ooh. Whoa!
Do you have a syringe?
Put some shavings on that. Do you have a syringe?
We don't have any records from her, from anything with her
no.
EPM? Okay.
I'd assume a fence maybe or something.
Yeah. Feels very old and scar tissued. Don't see anything, obviously. She said it was draining still?
Not anymore.
Not, okay.
It had just
It
been,
had been, okay.
a rough one.
Got it. You're all right, honey.
I think her biggest worry now was just how off she seemed in the back, and
Sure.
she thinks it's the EPM.
Okay, let's see her walk and see what we're dealing with here.
She kind of like wobbles and like, you know.
Yeah.
It's okay, honey.
Definitely doesn't seem quite right, huh?
No, it is a little goofy.
See if she'll trot at all. I just want to see how bad we're talking, I guess. You trot?
She did say that at a trot, you can't notice it.
I was going to say, it actually looks better when she trotted.
That's what I thought too, and then it made me think of that. She said it's just really at a walk that it's noticeable.
It's interesting. Huh. It's like she almost picks up that one like she doesn't really know for sure where it is. Hi, come back.
Mama Rose, stay.
I just wanted to feel your back a little bit. She's like, I don't want you to feel my back. You're all right, you're all right. Can I just peek at you from a distance? She's like, no. Just wanted to see her muscles. Is it worse when her head is up? It seems like it. Okay. I mean, EPM definitely a possibility. She's certainly not quite right. They did treat her, were treating her?
Yeah.
Okay. I mean, I think otherwise she looks good, so that makes it.
Should we just kind of see what happens
I would
as we
see
get
how
her into work?
Yeah. How she ends up being. Because, yeah, at a trot, she actually looks pretty good, so.
Yeah. Okay.
Yep, I would see.
Yeah.
Yeah. Yeah, I would start working on her, see if she does anything.
You did? Like it was new the last
New.
time I was here, yeah. I've just been taking vacay, man. So that right crest of the ilium is displaced. Like it's stable. I can't get it to wibble. But I don't know if that's stable because of the amount of musculature that's around it or not, because easy babies. I know, she's like, I can't step on her foot now. So this hip is way the hell up here. And it's here on the other side. So whether she was born like that or she had a traumatic injury, which usually that's traumatic injury, I don't know, but I can't fix it. Sorry, babies. I can do a lot of things, but that I can't. However long this has been going on, it's been going on, and she's compensated, but the problem is the compensations hurt. So when we have that luxating patella, the stifle that's clicking in and out, it hurts. She's not going to be able to actually lock that guy to be able to sleep on that right leg either. So that's not comfortable. She's going to have some pretty major arthritis going on, and we'll never see that on rads because we can't get up here. SI is going to be nasty. The rest of the lumbars from being constantly tweaked around, yeah, I don't think that's comfortable at all. Sorry, kiddo.
I know what we thought.
I wish I had better.
We suspected it was pretty goofy, so.
It's not good.
All right.
The stifle stuff, we can get them rehabbed and get them comfortable. We're not gonna, yeah, yep.
And you were saying we can't even x-ray to see anything
No,
up
so
there.
if you have a super powerful x-ray, like the ones like at universities, referral centers, things like that, you can get like a glancing view of that, of the edge of the pelvis, but it's still like, you can see it.
Just to confirm what you basically.
Right.
Yes.
Right.
And then you spend a lot of money. And her in a trailer, ouch, that's gotta hurt
Moving on.
being in a trailer and getting all that jostling. So, yeah. I don't think that's anything good.
No, sorry, Z.
Sorry, kiddo.
So this is Jenny. She came here today. The people said that she's just kind of nervous, more standoffish, and they just feel like we could maybe find her a better home. So they brought her here. She's super cute.
Mm-hmm. Very cute.
Good job, Jenny.
Turn this way, honey.
She says if you can move me.
The ears are so big.
Oh my gosh, that's backwards and that's confusing. It's backwards and it's confusing. I know.
When you said that, I was like, oh my God, I've never done it that way.
I know, I've never me either, so I was like, whoa, that doesn't look right. But it works. It does the same thing.
Right? Definitely.
You don't need the greatest, but I know you need to.
It's all right, honey. Yeah. Oh my goodness.
Can we go in there and hold her?
Hi, honey. What do you think about things, huh?
They said age-wise, mid-teens.
Okay.
So we don't have an exact age at all.
You are so cute.
And then her right hind does
Yes.
have some kind of injury back there.
I saw that. She's super upright on that hoof, too.
It sounds like they were just putting swat on it to keep the flies off is all they've done.
Yeah, maybe call her like 13. Not too terribly old, huh?
I think I put 12. The standard.
Whatever our favorite number is today for that range.
Well, they said, I don't know if you said this already. The people that got her from
I did not.
put her in her 20s.
Oh, really?
Their vet put her like in her teens.
Okay.
Yeah.
She's definitely a little chubby. She's got some
Got a good crest there.
nice fat pad there. Her hoofs are really not that terrible besides that one. Seems to be longer than all the others.
I think they said 3 weeks ago they got 3 out of 4 trimmed.
Oh, that must have been.
She said she did that one because of the cut or whatever.
Sure.
Yeah. The leg.
Well, that makes sense. Well, at least you were good enough for the other two, huh?
They also said that she had been exposed to a jack for 3 months.
Oh.
But they checked her about a month ago and she was not
Okay.
in full, so
Whatever happened within that last month
yeah.
or this last month, we're not sure.
Well,
We'll see. We'll keep an eye out.
Right. Keep an eye on it. Let me know if there's some sort of development of some sort. You're so chubby right now. It's kind of hard to tell. Yeah,
Seems like he
yeah.
only
I think
does it
other
when
than
he's-
some weight loss, we'll keep an eye on that wound too. It looks pretty superficial at this point.
okay.
So this one coming in is taco. Got it. Ooh. 1645. 1650. So health issues, pretty noticeable.
Yes.
Right hind has some cellulitis going on. Otherwise, looks to be in good shape. But we also haven't had the greatest luck with cellulitis.
I was just gonna say, do you guys usually try to treat cellulitis?
We try, but I feel like that one might be a bit too far
This
gone.
one's pretty big. Yep.
I would assume there's some bony joint
Yeah.
changes in there.
I would agree with that. Can I see your mouth? We'll give you 13 too. It's an infection of, usually it starts off with a wound and then horses are really prone to it for whatever reason. And then it's kind of an infection that spreads underneath the leg. There's also some debate of like cellulitis versus CPL, which is chronic progressive lymphedema, which is a genetic thing in these guys. So whether it's more so that, whether it's actually cellulitis, hard to say once we're to this stage.
So, is that like fluid?
Yeah, fluid buildup.
Basically infection.
Right. I know the one we had before, it was really obvious. It was like draining nasty. I can't remember. That was a while ago.
I think I
Remember?
with like a bunch of cuts. And
Yes.
stuff. Yeah, I remember that.
This almost looks like maybe there was a wound there at one point. Or it's just leaking. It's hard to say now. It's got a bunch of other little ones. But yeah, it's very hard to get under control, especially once we're here. If it's CPL, there is no getting it under control, period. If it's cellulitis, you have a chance with antibiotics, but once we're to this stage.
You kind of just, if you're going to try, you try the cellulitis stuff.
Yes, exactly. So potentials for her as far as what we could do, hit her with antibiotics as hard as we can. I would bet that's not going to make a difference, unfortunately, with this severe of a presentation, so.
Does it like progress fast, or is it like a slow progressing infection?
Oh, like when cellulitis starts, it's definitely slow. Like you can tell the leg is bigger, but it will only be, to a normal person, you might not notice it for a while, and then
And then it's big.
This has probably been going on for months. I think you're only reacting to that because it hit your eyelash.
Yeah, I think she might struggle to see. Yeah,
Yep.
sure thing.
Definitely one.
Explains why she was.
It looked funny. And then
This
she,
one you must be able to see out of because you get around okay.
And then she bonked her head into it, and I was like,
Wait a minute.
okay.
Yeah. Left eye blind.
Blind in the left.
Oh, kiddo.
So this is Cevichi coming in.
Come here.
She says I'm not coming in, actually.
Or I could.
Over.
All right, kid.
$12.75.
Okay, so old injury between, I guess, her butt cheeks straddle the fence. And then up here, if you look at her hooves,
Yeah, I see
he was
that.
pointing those out. He thinks she has ring bone.
Okay.
She hasn't been sound for a while. Used to be really good at, in the past, I guess, in the fields, not pasture,
Right.
and driving. She still did that a little bit, but now she's just too lame for his liking.
Yeah, she walks kind of tilted
Yeah.
inward or outward actually at her hooves.
And we have 20 on her
Okay.
for age.
Yeah, I think 20 is reasonable for. Let's do some x-rays of the front feet and pasterns and see what that looks like.
Okay. Otherwise good?
Otherwise, looks pretty good. Perfect.
No. You gonna come in or no? So I believe this is Alfredo.
Alfredo?
So he at the auction, there wasn't actually really anything wrong with him. Just ended up with us.
Didn't go for
But
much.
they said yes, but we haven't really noticed much either.
Right.
Looks to be
He
in
looks
decent
pretty
shape.
good so far. Yeah.
We're okay, Alfredo.
All right.
We're okay, buddy.
They're so funny sandwiched in the stalks. They barely fit.
Come on in, kids.
What do you think, bud?
We have 17 for his age.
Okay. You just don't seem worried about everything, huh? Oh, your incisors broken. It's all right. Oh, big head.
Oh, still, you're all right.
Don't hit Kylie. Don't hit Kylie. Can I see this side? They're both broken.
They're both broken?
Oh, yeah. Yeah, let's leave him at 17. His lower ones look pretty long. Not too much to note about him. He looks pretty good overall.
Okay, so I believe this one coming in next is Barbie. She's a lot like Taco, only her other leg is the big one. Now hers is a little smaller than the other one.
Mm-hmm.
Come on, sweet girl.
I know, hon.
We have her at 18.
Okay. It's all right. It's all right. You can't see your pretty eyes under there. Here we go. Oh, she's not very old. Give her 11.
Sweaty underneath.
Ugh.
She's sweaty under here too. You hot or feverish? Oh, you have so many flies. She's kind of gross and oozy all over under there. I'm sure that hurts. You can see the flies are just clinging to it.
Oh, yeah, I can
See all the kind of open wounds in there.
Yeah.
Her fur is just hiding it a little bit. She's got a bunch off the front too. The flies are loving it. Poor thing. Girl. So same conversation we were having with the other one. Cellulitis, CPL.
You can try the antibiotics and go from there.
Yeah. Again, they're both pretty far progressed, but can I just... Yeah. Exactly.
And I think the other one was 101.
Yeah. Leg is a little smaller than the other one. Hers definitely has more open wounds to it.
Sure.
Oh, you're a good girl, though. Yeah, I would say.
Right. Same thing.
Same thing for the as the other one.
So this one coming in is Scampy. They said that Scampy was kicked on the trailer and the hind leg. I can't remember which one right now, but it looks a bit more like maybe the start of CPL or cellulitis to me.
Oh, yeah. Yeah.
Right hind.
Yep.
1400.
We're moving.
Sit still.
1407.
And then we have him at 19 years old, or her, him or her.
Hey, sweetie. What do you think? All right.
Miss my eye.
I know. What did we have her at?
19.
19. You're pretty cute. Droopy lip. I would, if we're gonna be picky, I would say like 17 maybe.
Okay.
In the teens.
We'll leave her where she is then.
Yep. She does have a lot of little scars everywhere. I'd say this definitely was not like a she got kicked on the trailer kind of a thing. This is just the, a little bit of an earlier stage than the other two. So recommendation's kind of the same. She's got a couple wounds on both hind legs, so I'm not sure if that was where it stemmed from or not.
Hers is kind of smaller, so maybe if we catch it now,
Yeah,
we can...
yeah, that's the hope. I would say she has definitely the most mild presentation of the three, so.
Sure. Perfect.
We'll
We'll
find
do that then.
Nothing else too exciting about her.
So we got some lead ropes on Jambalaya here.
I know.
We'll try and get them in the stock and get them looked at, because we need to get that eye looked at for sure.
I always think that one hoof and she's gonna.
Yeah.
Yeah, of course, Kylie just was.
Yeah, that's good.
If she can get him in and you can shut the thing, Kylie, yeah.
Yep, that's what she's trying, I think.
Try just holding it above it so you can just. Good thinking. Come on, dude, it's okay.
Come on, big boy.
Good boy.
Need to shake the green? Do you want the green?
There's a dish of grain in there.
Oh,
Oh, yeah, there's one.
you could supply the sound effect, Jody.
Right.
What if? No, he's not there now.
Do you want to walk in there and see if he'll walk in, or come grab him and I'll walk in there?
I don't want to be trapping out there.
Yeah, I don't want to go in there with him, no. But I will come hold him. You're a sweet boy, but you were kind of mean to me. I'm not going to lie. You didn't need to do that. Okay, Bubby.
Hey, I'm right here.
Yeah.
Got it?
Well, Kylie, you're not coming in here, but. Can someone get Kyle's rope on the other side? And then she's coming out.
Hey. Go, big boy.
Come on, buddy.
Gonna have to duck.
Am I closing this?
Alright, easy.
He says I'm too tall.
Oh, yeah, that's bad.
You gotta put your head down.
Come on, bud.
Your girlfriend's right here. Good boy.
Oh boy.
Says, well, from my girlfriend.
1816.
Okay, so this is Jambalaya.
Hi, buddy.
His biggest thing is the issue with his eye on the right side. Aside from some maybe behavior issues, whether it's pain related, I don't know. And we have him at about 8 years old.
Okay. I don't know if we're going to be finding out that for sure.
You can just be 8 for now.
Right, yes. Not a fan of sticking my hands in his mouth necessarily yet. Are you okay if I touch you?
I do know at the auction when it came to touching, he was nervous.
Yeah.
So. You're okay.
Just don't take my head off.
But it was on his other side that he was more nervous of.
Sure, by
With
his
the eye.
by his
so,
eye.
Yep.
We're just gonna let you keep your hurts content while you're in.
Right, yeah. No reason not to.
Huh?
Okay. Look at them lips go.
Portion up.
Hey.
It's massive.
I didn't realize it was like the whole island. I thought it was just like under the eye.
There, good boy.
And the halter's like rolling in his face.
It's okay. I already touched you there.
Move to the other side.
Yeah, I'm not sure what his triggers are.
It was really just
He kind of just, when I tried to touch him at the auction, he kind of just did this little,
Yeah, I saw
Turn a
a
little.
video, like turned
he
away from
seems
you.
more
Yeah.
calmed down minus the pasture thing.
Yeah.
yeah.
And I do think that's the thing with the mare. This one in particular.
Sure, he's more just protective.
Protective.
Yeah. So this lump is almost certainly, until proven otherwise, squamous cell carcinoma just because of the location. So anything ocular and scary is basically squamous cell carcinoma. There's not a whole lot of other differentials for ocular tumors. Prognosis is considered poor if the eyelid is involved, which I would consider this to be. It depends. It's not a tumor that we worry about metastasis or so spreading somewhere else a whole ton, but local invasion, it's very locally aggressive. So how far that goes into his bone and his orbit, he sure seems to be able to. Can you see from this side, sir? I also don't want to freak you out.
Looks like he reacted a little bit.
Some at least. So I don't know how much it's affecting his vision. This would certainly be like an ophthalmologist needs to see it if we were going to do anything. But I don't know that it's necessarily worth it just because of the extent of it. I think studies, so if you catch this early and you remove it completely and the eyelid isn't involved, median survival time is like 4 years. He doesn't really fit any of those good categories, so I would say his median survival time would be much less than that, even if you spent the many, many thousands to have an ophthalmologist remove it. So I think overall it's not a good prognosis for him. That's what I have on that. I don't know how much I want to push my luck with you because I'm curious how old you are, but I don't want to stick my fingers in there.
Can you see his teeth when he tries to eat at all?
I was wondering, can you have him like reach for it?
Yeah. See if he'll reach for it. Open your mouth.
Open your mouth a little bit. Just curious if that half a glimpse didn't look very long, did they? So I guess.
Pick it up.
I know, but we're all staring at you. You just don't have a good track record so far.
And I think your face probably hurts from that halter.
Yeah, that too. Definitely digging into you, huh?
Oh my God, you're scary.
He's getting out of my reach. You're okay. You're nothing.
It's not great, bud.
Okay. Reach, Mom.
Come here,
I'm
bud.
trying to hold the rope too. Can I tickle? Can you smile?
I know, that's what I want him to do. Like, just pick your lip up. Don't you know any tricks?
Oh, and of course covered in green.
I don't think, he doesn't look too terribly old based on the limited views I keep getting of them, though. Hard to say, but I don't think he's in his 20s or anything. But
even with age, it wouldn't change.
it doesn't really change anything, no. Just makes it more unfortunate when they're not very old.
Yeah.
So is it just a tumor?
Yep.
Not like cancer?
Oh, it's a cancerous tumor, yeah.
To get a rough height.
All right. Sorry, buddy.
Yeah. Unfortunately, eye tumors are that's pretty much what it is. Yep.
1335.
Okay. Confirmed.
She Dumpling. We have her at 7, and I just think her butt kind of looks weird. Just her hind end might look a
Yeah, I
little
agree.
goofy. Like, it almost kind of looks like her stifle sticks out a little, but she's also very nervous.
Just looks like her hindquarter doesn't fit the rest of her body at all.
Right. See how her stifle kind of just
Yeah.
turns out back here a little.
Oh yeah, she's young.
7 good.
Yeah. I know,
Oh,
I'm
the little
sorry.
teeths.
Little
Okay,
teeths. Trying to figure out what we got going on here. Just want to see if her
Even like
others-
standing right here, I don't know if it's because she's leaning or if she's just kind of like Z.
Yeah. It's definitely not right. Can you step forward, stand on it square a little?
You see that?
Yeah. I know, you're stuck in there. Maybe have her step back. See if she'll step back on that other hind and just so she's standing a little more square. If not, then that's okay. Whoa.
Well, don't say
Well, that worked. Oh yeah,
feet at
wow.
me.
That's not right. So her hip, like in comparison, is here to here.
Yeah. Kind of reminds me of Z over there.
I know. Worried about it being higher up by her hip just because of how big the drop is, and then she stands with it rotated out.
Sure.
All right, kiddo. Just because of her age, I worry about some sort of injury, so like a pelvic injury of some sort. Her hindquarters on both sides just seem like she's under muscled, like she's trying to offload everything to her front.
We have Cairo take a peek.
Yeah, this would be the perfect thing for her to look at. Might be a similar thing to Z's.
Okay, so when we first got her, she was so far, like she was basically walking on the back of the pasterns there
Yeah.
and on the front. And so she's at what, 6 resets, and the fronts are doing well,
Yeah.
but she was also very like this constantly, so we don't know if that's what caused this. Or,
Yeah.
because when I look at her from the back, she kind of does this. But again, I don't know if it's how she's standing or what exactly. She actually looks really good compared to when we got her.
That's good. This is malformation.
So like born that way basically?
Yeah.
Okay.
I mean, I suppose it could have been from injury, but this is too symmetrical from side to side, and we even have, so besides the fact that we have no thoracic curvature, these ribs are displaced as well. So, yeah, and good, gosh, darling. Wow. So if horses get scoliosis just like humans. So with this one, it's also, do you remember the one we had a couple years ago who, don't ask me names, but I remember one of them was malformed like this, but the spine moved well. So it was just one of those like, You're never going to be a riding horse.
Yeah.
But comfort level is what I care about. If this is, if we can get them pasture sound, cool. Yeah. Whew. Kid. Let's see what we got. Some of the stuff I wonder about, like how it's not good for her to be so far back on the fetlocks, but did we start with this and then being so dropped in the fetlocks was the result of it? That was the compensation to get her moving as normally as possible, or did we start down here
And get that.
and get that?
Yeah, like when we got her,
Yeah.
this was down here. Like, she was, way down like that.
Yeah.
So, improvement there. X-rays
Yeah.
look good.
Okay. You guys aren't throwing me any easy ones today, are you?
Welcome back.
You are gorgeous, just the way you are.
Thank you.
But now my adjustable legs don't adjust.
Oh no.
Yeah, well.
Got this new cool thing. Then you couldn't use it for a while, and now here we are.
It was like, I got to use it for like a month and a half, man. It does not eat any horses. We're okay. Hi. That donkey is stinking ridiculously cute.
Cute.
Yeah.
Yeah, she is.
Perfect. We got the scoliosis going on. So, you guys can go ahead and laugh at me when I crack my head on this thing, because I will. Yeah.
I'll just keep telling you duck.
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 Oh, yeah. Use it, babies. So, I mean, she's moving decently for being goofy. Very tight in these lumbars, which I would expect when we're so wither high and butt low. And it's taken out, so we don't have like that normal curve in the thoracics or in the lumbars. The lumbars have straightened out as well, and it kind of, you get like the visual illusion that we have a little bit of that curve back here, but it's just flesh that's given that. Good girl. Good job. You're okay. I know, what am I doing? There's all that noise.
Someone's getting their teeth done.
Okay, here's a question. Am I going to be able to stand on one of these cross braces?
Yeah, you should be able to.
Okay. Well, I'm a little more luscious than I used to be before my injury, so...
It's held in, we've had horses like climb over them and hang on them.
Okay, well, I'm not as luscious as a horse, so...
Duck.
I love my patients. So, I'm not appreciating much for muscle spasm. Little tight as we get into those lower thoracics on the right side. But I think she's just... She's like, yeah, give me the massage, lady. I feel so tall right now.
You look tall.
Thanks.
You're the tallest horse we've had here.
Duck.
Duck.
Yeah, you guys have had some pretty big ones. Yeah, we even have it's not just like twisting to the side. I feel like the vertebrae have twisted this way as well, because the actual spinous process, you know, there's an inch of difference between where it is up here and where it is over here. So we're actually twisted. Almost. Oh, we might have a couple that are fused there too. That wouldn't be surprising with the changes that we have in the spine. She doesn't seem to care. She doesn't have anywhere that she's particularly sensitive. For how goofy this spine looks, it's moving pretty well.
Would this keep her from being rideable ever?
That's a great question. I think that unless you have a really small animal,
Saddle fit's gonna be a nightmare.
yeah, you're not gonna get something to fit like that. So unless you have like a kid on a bareback pad,
Not likely.
that spine isn't gonna follow any kind of tree.
Okay. Fair enough.
So, and riding her bareback, my butt hurts thinking about it.
Yep,
so.
same.
So if she's otherwise comfortable, we're just looking at pasture bedding.
I think so. And from what I'm feeling, she's goofy. She's never going to be normal. But I'm not seeing a lot that's telling me that she's in an extreme amount of discomfort. We're not having the reactions to palpation. We're not having the reactions to the actual adjustment that I would expect if we were severely painful.
I feel like she's just more confused than why you're up this.
Yeah, like, why are you my height? Hi. I know, I'm not used to being your height either. I see the world from a different perspective. I am actually pretty truly impressed with how well she's moving. I herniated my C5-6 disc.
And it was from a horse?
No.
Oh, okay.
This is not an injury. Well, 23 years in the Army. So that'll break anybody. But I have degeneration C4-5 and C5-6. So C5-6 just decided to like make an escape.
Was just done.
Yeah.
We're
Like,
out. Peace out, guys. See ya.
Horse related.
nope.
Happened?
Yeah, so I've actually, like, in hindsight, looking back, for years I've been dealing with this. It's just, oh, my trap is tight. I just worked out too hard. And it was always my left trap.
Okay.
So, yeah.
So it was trying to tell you, and then it was like, yeah, now we're gone.
Yeah, but interestingly enough, about 80% of herniated discs will improve with physical therapy and NSAIDs and ice and rest and all that stuff.
It's not typically a end-all be-all injury. Just
Yeah, and then the other 10% will, you can get, I know I'm talking, I'm ridiculous. Another 10% will resolve or at least be manageable with epidurals.
Oh.
And then it's only like 5 to 10% that end up in surgery. So I just had to be exceptional.
Yeah, you know, special.
Yeah, it's totally what's going on there.
Duck.
Oddly enough, I can remember when I was 19, I got a whiplash injury. Mm-hmm. That is probably what did it. Like, so all the stupid crap I did when I was young, I regret it.
How many times do they say it catches up to you?
Yep.
It does.
Well, I mean,
Most things catch up to you.
unless you die young, you're gonna get old. So I would rather get old. I am really impressed actually with how well this spine is moving. So from my perspective chiropractically, she's gone 17 years probably like this. And she's moving this well. I don't see any reason why she couldn't do pasture. And depending, if you got a little kid and you want to slap them up there, that's probably
Just some
be all right.
lead line stuff.
Yeah, I wouldn't be doing any more than that.
Okay.
So this here is KD. He came here. He's got some arthritis in his left knee. but then he also has issues with pulling back hard. We kind of seem to think it's more behavioral. We did do x-rays of his back. Dr. Kenzie did not see anything notable. But we just thought, would have you take a look as well?
Yeah. Let's see what we got. So it's pretty decently sway back. How old is he?
I would say 20.
Somewhere right around there, I think.
Pretty sure, yeah.
I think it's like late teens, early 20s.
Okay.
Oh boy, so sternal lift is really good. So he releases. He was pretty stiff in that right hind when he was walking in.
Could that be compensation from the left front?
So you can look at either having, oh, you're subtle. You have these spiral fascial planes. So this is why you'll often see when you have a lameness in one leg, that contralateral limb, so that opposite limb will be affected in some way. And I've had some horses where it appears they're lame in one limb, but the actual problem, like the main issue with muscle imbalance is in that contralateral limb. So, sir, we got to work on your core strength. But he gives really easy, so that butt tuck and that sternal lift are really good. It tells me that you have some pretty good flexibility. Right, Atlas. You gonna be a good boy? Thank you. So, right Atlas, that can cause fight or flight where we're stuck, activates sympathetic nervous system, or it could be, hey, we were stupid and we pulled back, and that's caused the Atlas to not be moving correctly.
And he did do that several times that one evening.
Kind of weak. The tail pulled to the left.
Because we don't have legs.
Better on the right, but if a horse is stocky as him, I really shouldn't be able to throw him around. Better. Yeah, you're cheating. I see that. But you can't pull me over now. You know, I would guess all of your junk in your neck is from your shenanigans. Maybe stop the shenanigans.
So think about it.
And then I'll do what I want. That's some pretty impressive stuff you got going on there, sir. No nibbling on my patient. Thank you.
Mama.
Boys are trouble, honey. Just
Yes.
stay away from them.
Especially this one.
So, quite a bit on this left side, but he's not. He's not particularly reactive. But you have a good releases, sir. I think you've been shenanigating in the pasture too, haven't you?
Ooh.
I'm not sure. Because he didn't show any pain response. That was right around L4. But, should we try? We'll see how you do with the veil.
Why don't you check it out? What you're doing. No.
I think you're a big faker.
She was even just in the one stirrup and he flipped out.
here. I'm in that L3 again, but he doesn't care. Sir, I think you might just be naughty.
Mirror.
I'm not super impressed. Nothing wrong there? No. I mean, there's a chance adjusting that atlas may adjust the attitude, but
Until he pulls back again.
until he pulls back again. But I don't think that this is, from what I'm feeling, I'm not seeing a chiropractic cause for his naughty behavior.
Okay.
So that's at least something.
We've kind of ruled everything out. Besides
Shenanigans.
McFly.
Yeah.
McFly.
Oh, sir.
So, Miss Rev and Mr. Mai are going to be going to an adoption partner today. They specialize in Arabians. These guys need more consistent work. So I think it'll be a better fit for them to further their training and decompress easier. You got it, girlfriend. Good job, Rev. All right, Mr. Mai, you're going too, bud. You'll do great.
There's a horse in there.
Good boy. You remember. Good boy. And check it out.
Well, he's gonna learn real fast how to get treated for scratches. Oh no, really? I think so. I can't tell if it's mud or that.
Good boy, my.
He's a good boy. He's a good boy. Come on, take another step.
Very nice. Yeah. Good. Yep, that's the floor. Very good. Good job. So this is Jenny. The guy, I believe the husband or boyfriend or whatever did the trimming. But they did 3 out of 4 feet. They didn't do the one back here, the right hind, because of
Is she broke?
a cut. They don't know. She's really good and super sweet. She's just nervous and just, they don't really,
She what?
she might be pregnant.
To what?
Supposed to Jack for 3 months, but they checked her about a month ago and she wasn't pregnant.
Aren't donkeys one of them? They're either like pregnant for 11 months, but they can be pregnant for like 14 months too or something.
Really?
Yeah, it depends on like if they're a mini or a stand. I don't know.
Huh. She means well. She's just nervous.
Yeah.
And she's so stinking cute. All right, babe. Good girl, Jenny. Feet look good though?
Yeah.
Sweet.
You don't like your ears touched.
Oh, so sad.
She's pretty sweet.
She's super sweet.
She loud?
She's squeaky.
Yeah, she hasn't like fully went
She
off.
did once when Vet and Cairo were here and her friend moved, but otherwise she just kind of squeaks.
She respect fence?
Hasn't been out there yet. Here.
Okay.
I guess I don't know her setup from where she came. Doesn't sound like they had any issues other than just they weren't quite experienced enough for her. Good job, babe. Almost done.
I think I need to take this thing home. Cool.
All right, all done? Good job. Good job, Jenny. You did great. So, Mr. Titus, we're hoping that that whole tooth thing he had going on was a lot of his behavioral issues, pain related.
He is blind on that side.
Mm-hmm.
Yeah, blind on that side. So we're hoping maybe we can get his feet trimmed today because he really needs them done.
In the face? Yeah,
Tried to kick,
I remember.
yeah.
That's why I'm kind of going from the front.
You're okay, buddy. Good boy. Good job, Titus. You're okay.
Just don't let him get you, Kylie.
You're okay. Drug him.
That way he doesn't get too worked up and they don't work or go backwards.
That's what she does, mainly.
Petrie's like, shut up. Can we go?
Is this a mirror?
So this
4-year-old dough head? Oh, sorry.
He has a paint.
he's a 4-year-old doughhead.
He's a paint.
This is Petrie.
But his feet don't look bad, so I'm thinking he's probably been done.
Yeah. Don't know how he does for him. He's a lover, but he can be a little nervous.
You need it done?
No, not really, but I'm gonna... He's got a goofy lip on his foot, and I don't know if it's just from being soft, and he's just a smidge long.
Oh, I see.
Is he broke?
No.
No? Has he ever had a saddle on?
I think you guys did tack him up and he just... Didn't you do some crow hops or something?
Oh, we should saddle him and ride him today then.
But he's not broke.
Well, we can start him. Yeah, Cindy, they had a mule there at the sale that they come in and it was, you know, the kid broke, safe, the whole 9 yards. Mm-hmm. And all of a sudden it just starts bucking. And it like does this extremely slow rear up and like launches the guy and the guy come over the, yeah. Yeah.
So what did that mule go for?
Like $37.50. Yeah, it was just under $4,000. But it was because it was a gray.
Ah.
I can ride a horse that bucks, but I can't get around a mule. They just buck so much different.
I think they move quicker. They tuck their butts and I don't know.
There's just so much more forward. I mean, they just want to like, they just want you off the front of them.
Yeah.
They must have done him not too long ago.
Okay.
Or he just has good feet, but he's got baby brain.
Yeah.
Big
I told
time.
you, he's a doughhead.
Well, he's a pain.
All right, Titus.
Last time I touched him, he tried to rearrange my face.
He was a
Literally.
He was a lightweight for the vet, so maybe he'll be.
Hopefully.
Yeah.
Hopefully. We'll see.
You got it, buddy. You got it. A little bit more.
Hey, fella. You're okay.
Good boy. You're okay. Good boy. Good boy. Good job.
We attempting backs too? He let you do it, didn't he?
Not with my hands yet.
Okay. But he let you with a stick? We'll see.
You're all right. You're okay, Titus. You're all right. It's okay. If you don't like it, we won't push it. Did he crack?
Yeah.
Good boy. Good boy, Titus. Good job, Titus.
Hey, buddy.
Last one, buddy. Can you do it? I think your kids are entertaining him.
Mm-hmm. I think it's helping. Okay.
Good job, Titus. That was such good boy stuff. Yeah.
He come from that Stanley deal, didn't he? No?
He did. Yep. We just weren't the ones who initially got him at the auction. Yeah.
Seems like some that I've trimmed out of that group. I don't know if them mares, I'm gonna assume not, just by looking at their feet, but I don't think any of them mares had like the proper mineral or diet during pregnancy, because the feet is just trash.
Kind of a crazy idea.
What?
Do we try a meet and greet with Nadia?
Yes. All right. So we got Mr. Montague. We're thinking maybe if we just let him eat some grain, he can maybe get his feet done. See how he does. You're all right, bud.
You should remember me. You're all right.
Dude that got on me.
Good job, Montague.
He ain't got a lot.
No,
No.
doesn't have much to take.
His feet?
Pick him up. Oh. Oh, you're all right.
You're all right.
Easy. Yeah. Nothing.
No?
No, you're all right.
Oh, he was just trying to smell you. All right, well, sweet. Progress. All right, Mr. Sturgis. You're all right, buddy. Maybe not. Might have to work with him.
Trying.
He's been doing good.
Yeah, he's doing good for her.
He says, I don't know you. There you go.
Good. I want to keep working with him so I don't piss him off.
Sure.
They're not horrible. You're pretty. You're gonna be big. Yeah. They're not horribly long. She said she just... I just told Kylie keep messing with him so we don't traumatize him.
All right.
Yeah.
So we're going to try Miss Nadia. She's been doing so well. So just And remember, she's blind in her left eye. I believe.
Yeah. What's up, Mama? If we don't get it, we don't. Okay. Well, we'll just do what we can. If it don't, it might not happen.
That's okay.
Yeah, right here, smell.
Good girl.
Yeah. Homer. God. High strung. Ain't you?
You're all right, honey.
What's that
You
bay
just say
halfway
hi.
up the hill? What's the
That's
story
Rev.
there? He's a
Rev.
Rev.
Rev?
I get him confused.
That's
Is
okay.
he broke?
He's one of the babies like Sturgis and Raleigh.
This bay halfway up the hill here?
Yeah.
He's big.
I think he's 2 maybe.
He come from South Dakota?
Yep.
Okay, let me pet you. And then I'm gonna leave you alone. Homer. Yeah, okay. All right.
Okay, Naughty.
We'll call that good.
Call it good.
Otherwise, she's gonna get scared.
All right.